Welcome back to Just Simple. In this video, we will be seeing India's first potential indigenous vaccine of COVID-19. For the name of the virus is SARS CoV-2. So based on the news, registration for human trials of Indian vaccine for coronavirus begins. So here, let's go step by step and first understand what is a vaccine. To understand this news, let's see what is a vaccine. So what is a vaccine? And we also have a couple of questions to be answered, like what is the difference between a vaccine and a drug? So basically, vaccine helps in prevention of infectious diseases. So this is a basic understanding of what is a vaccine, which will prevent us. So when we come to a drug will help us in curing the disease based on the symptom. So with relevance to COVID-19, the symptoms are headache, cold, fever, breathlessness. Whereas we also have certain asymptomatic patients, and the drugs which are given to most of the COVID-19 patients in India are remdesivir, hydroxychloroquine, and these medicines are given on the basis of the doctor's prescription, and they cannot be used by all the patients. There are certain restrictions laid down to certain people based on their immunity system and based on their age group. So they are divided in these ways. So coming back to a vaccine, so this is the understanding of the drug. So vaccine, even more in a detailed way, which is preventing the disease, and also it gives us an acquired immunity to prevent us from falling sick into the disease, which is basically made up of weakened archaic form of the disease, which will be injected in our body, and or it can also be taken on an oral way like we do it in polio. So here it could be in form of injection, which will prevent the effect of future infection. So since the disease will be injected in a weakened form, our body will naturally produce the immunity to fight against this disease and fight us in the future to suffer us even more worst when we are affected, when the virus is much more stronger. So based on the news, which is the body which regulates these drugs? So the body which regulates these are Central Drug Standard Control Organization, which will regulate Indian pharmaceuticals and medical devices. So coming back to our news, COVID-19 vaccines are global in the global race to end the coronavirus pandemic, ICMR. So it is ICMR who has developed this vaccine, who along with NIV, National Institute of Virology, to manufacture COVAXIN, which could be the potential indigenous vaccine. Also we have ZyCoV-D vaccine, which is by Zydus Cadila. So COVAXIN, where the manufacturing will be given to Bharat Biotech International Limited. And to understand what is ICMR, ICMR is the apex body in India for the formulation, coordination and promotion of biomedical research. It is one of the oldest and largest biomedical research bodies in the world. Human trials of Indian vaccine. So let's see how are the vaccines developed and which stage are we right now. So basically we have around 6 stages in the vaccine development. In the first stage, we identify a vaccine. In the second stage, we test it on animals. The third stage, the clinical development stage, we use it on human beings. So this is the stage where we are right now, where we use human trials. Under this, we have 3 phases, where in phase 1, which is based on small group of people. So the trial is done in small group of people. In the phase 2, the expansion is made on the basis of similar characteristics with reference to age group or health factor, which involves the second phase. The third phase involves thousands of people, where they will be tested using based on the efficiency of the vaccine. The next stage will be regulating and reviewing and approving this vaccine as to how it functions or if there are any modifications required. And then the manufacturing of the vaccine is given. Presently it is under Bharat Biotech for manufacturing, and then we do quality control, whereas in case in future the disease mutates, we also check and check the control of the vaccine, and that has to be also checked in future whether it is meeting the need of the vaccine, the basic requirement. So these are the 6 stages which gives us the overall development of how the vaccine is developed. And we also have another question right in front of us, that can one get COVID-19 twice? So till now we don't have any definite answer for this. Based on the current situation, there are no evidence that people recovered have antibiotics or they are protected against this disease. So we have to see how things are right in the future. So let's wait for it, and I will catch you up in the next video. Till then, it's just simple signing off.